When the patient has to fly abroad, over 90% of our patients are from overseas and outside of Germany. When they flew back, whether to South America or anywhere else, there were often complaints, maybe 15 to 20%, I didn't capture it exactly, about extreme pain as soon as the patient has overcome 2,500 to 3,000 meters in altitude. We couldn't explain it. We spoke with diving medicine specialists. We didn't find the solution. Since we have nails that no longer have any sealing and are immediately flooded. With the body fluid, this problem, which was a huge issue for anyone relying on flights, the fear was immense, unbearable pain that couldn't be compared to anything else, not even with the strongest painkillers. The problem was suddenly gone. How can that be? The problem was suddenly gone. How can that be? We assume that this happens during the assembly of the nail. Yes, at an altitude like here or at sea level or just above, at 10,000 meters, there is, of course, a certain amount of air trapped inside. The tube, when there are seals, is trapped. When it goes to higher altitudes and the cabin pressure, as far as I know, is adjusted to about 3,000 meters, and the plane goes to higher altitudes, then there is obviously an air escape between the thin and thick parts of the nail, and that produces this enormous pain. That's our explanation. Today, at least we have the latest generation, both in steel and in chrome cobalt, we've never had this problem again. So neither corrosion nor this extreme pain when flying at a high altitude.